Hello, friends. A very good day to all of you. Morning from RFA tutors. I hope everybody is fine. We were waiting for this day, all set to take Mrcog Part 3. I'm so glad and super proud of your efforts that we have reached to this point. I know that lots of nervousness and lots of anxious anxiety feelings are there today. Sampada, thank you so much for joining in. I know lots of thoughts will be disturbing today, but we are here to make the final set and final composed and confident attire to clear this exam today. Good morning, Nisha. Thank you very much, Enepu. And a very warm welcome to the last minute tips and the boosted discussion for all of you. How's everything? How's morale? How's the heartbeat? Do you guys wake up with tachycardia? And do you guys sleep with bombardment of thoughts? How's everything? And what is the biggest fear that's disturbing you today? What is that thought which you're not able to control? I would like to settle that thought today so that we are very confident in exam and we are taking this exam nothing for nothing but to be successful. Tachycardia on waking up, ma'am. Palpitations, ma'am. Very natural. Let me reassure that you're not the only one. Every single student, including your mentor when she was a student, we wake up with palpitations, lots of bombardment of thoughts, Pooja, and we always wake up with the negative thoughts or in incomplete preparation thoughts. And it is so natural. Every single student feels the same. It's so natural, Zarkesh, that we feel that we are forgetting everything and worried when I see a station and nothing comes into my head. Every single student feels the same, Selvi. Anxious that I'm not able to finish my revision. That's also a true feeling. And till the exam date, we would feel the same, my dear. We all would feel the same. It is so natural to feel this way. Whatever you're thinking, the first thing you guys have to tell yourself that I'm not alone. Every single student is feeling the same. Everyone who is passing through this preparation of MRCG3 who's appearing in exam is feeling the same. Then who is the successful student? Who is going to be the successful candidate? You all are appearing in exam. The one who would have a control over his and herself, the one who is going to have a control over the thoughts and be in the present situation in exam. How to do that? We'll discuss that today. All of you have prepared. It's about that final day performance. We all have done our preparation. We all know the domains. We all know the modules. It is that final day preparation. We have to make sure that we are present minded on that point, and you would do the job. For this, I'm meeting you today to tell you that nothing is difficult, but we'll go step by step for the last minute tips. First, and the most important thing, this is not extended match questions, single best answer, where you'll have thinking time. It is about coherence of your speech and your mind thoughts. Therefore, if somebody has not set the sleep pattern till now, please do it from today. What do I mean by that? If your exam is in the morning clock, please make sure that you have 8 hours sleep at night. And if your exam is in the afternoon clock, then please make sure that you wake up at that time, that is not your nap time. So many times students, they wake up early in the morning and the afternoon is rest, nap, or maybe a little exhaustion is there. From today, please write it down. Sleep is the most important thing in this exam. Even if you don't recall the applied clinical knowledge, you can't revise few of the stations, it's okay. But sleep would make you recall what we have studied maybe 6 months back. Do you guys understand? So from today, you're going to set your clock in a way that at your exam time, you all are ready for the exam with very composed mindset, with very active mindset. Safa, can I request to post the links in the mock groups as well, please? Few of the students are messaging, please. Kindly post in all the mock groups. Thank you very much. All right. With this, you all have to make all the preparations set today. So I don't want any last minute anxiety for you guys. Number one, sleep. Number two, ID checks and the preparation for what documents you have to take, which is your identity with you. And number three, dress code. Do not take it out the last day and wear it. Maybe it's tight from your sleeves, maybe it's tight from your waist and thighs, and you become uncomfortable. A very important element is your shoe, pair of shoe, because so many times it happens that you are wearing it. Oh my God, I've got a new shoe for the exam, and you're wearing for the first time in exam. It starts hurting you because it's not sitting, it's moving from one cubicle to the other cubicle. Do you guys understand my point? I'll do the checklist again. Please write it down for me. Sleep pattern 8 hours plus according to your time of exam. You should be fresh before your exam rather than being exhausted and sleepy. All those who are traveling, Hong Kong students, the ones who are changing the time zone, please make sure that your time zone is according to the next clock, and we can't expect the jet lag now. Number two, today you will make a folder, a bag where your ID checks would be with you, taking the printout of the invitation of your seat confirmation from college and your passport or your ID, whatever you're taking along with you. Number three, today everybody is going to confirm what clothes you're wearing. How do you look in that? You are confident wearing or carrying those clothes. Your shoes are comfortable, and all those who are wearing scarf and head covers, please make sure that they are tightly and very neatly tied along, and you don't have this last minute pressure on yourself. Am I clear on this? Yes, everyone? If any questions regarding the dress code or the ID or the sleeping hours, I'm here to address that. Anything which you guys want to discuss? You're clear about your dress codes, everyone? So Hansween, generally I suggest the formal shoes, no sneakers, no joggers, no running athlete shoes, but it depends on you guys. If you guys are comfortable with the court shoes, which are not having heels because you have to walk, it's okay. But if you can wear only around 1 inch or 1.5, that gives an elegant look, but comfort is most important. I mean, style comes secondary. It should be good looking. Closed shoes are preferred. I do not want that the open shoes. Please, closed shoes are preferred because that gives you graceful look, a good grip over feet as well, and you can walk. Dark colored shoes according to your dress. You can wear blacks, you can wear browns, grays, depending upon what dress you're wearing. But you can wear court shoes. Either the heel shouldn't be longer, of course, because your high heels can make you uncomfortable. It can be 1 inch, 1.5 inch, whatever you can carry. Absolutely flat also makes you very casual at times, but it depends upon what you're wearing according to that. Comfort is very important. I repeat, comfortable shoes. So if you ask me, I always tell students that 2 days before, start wearing shoes throughout the day in your home and start walking in that. So that if something, some place is hurting on your heels or maybe the little finger, so it comes up little toe, it comes up like obvious rather than on the last day. Dresses, simple kurta on a pant is fine, or a TP we need to look sleek. So it's okay. A kurta color match should be a light colored or a decent one. Shouldn't be a bright one, my dear. And pant is fine. Dress pant would be okay. You're appearing in India, my dear Priya, so that would do the job. Okay. Passport and ID, Reshma, please carry two. I don't want any last minute surprises, so it's better that you carry two IDs with you guys. Okay. All right. Any question with the dress code? According to the centers, the dress code may vary. Any question regarding the ID check? And I hope you guys are clear about the sleep. Yeah. Now, we all ignore in preparation food because we are busy and the stress reduces. The dress code in Abu Dhabi, dress shirt, dress pant, and a blazer would be fine, Dipti. A blazer with the dress pant is absolutely fine. Most of the candidates, they're wearing the same. Ashwini, blazer with dress pant. Mostly you'll find all the candidates in that. The color is very important. Dark colors, decent colors. You're wearing dress for Abu Dhabi, would that be all right? Or pants preferred? Sylvie, pants are preferred with a blazer. That would be preferred. Okay. Love, if you don't have a blazer, you can wear any sort of a coat. I don't know. You can give me the options, love. I can select for you. Right? Okay. Sadia Mustafa, Jeddah is first time. I'm expecting that Jeddah will be a little different. So you can wear a long coat, maybe till the knees and the mid thighs and the pants. This would be fine. Few of the Saudis in Riyadh, because generally when we have the Riyadh MRCPI, they wear gowns as well. So I'm expecting that few of the students, Arabic students might wear a gown and scarves. But if you have a long coat, I think that would do the job. Basically, the idea is to stay covered and be formal, right? Sadia, you can send me the options as well. Blazer and pant for India, Kolkata will work, ma'am. Absolutely, Hansmin, it will work. Indian attire in Abu Dhabi, Dipti, I don't think I would not suggest wearing a sari because I don't want any sort of a bias. It's better to be neutral. Dipti, do you get it? It's always better to be neutral, my love. All right. Formal shirt and pant enough and blazer must for Mumbai. If it's a formal shirt, it's okay. That's even fine. If you can carry yourself confidently in that and you feel that you're not uncomfortable, it's absolutely okay, Milan. Right? Sharmila, yes, it's okay, my dear. Blazer and pant, yes. Kamal, you can wear that, and this is the formal dress which you'll be seeing in most of the examiners and the candidates as well. Kolkata will work. Yes, absolutely, Hansbeen, it will work. Off-white color blazer and pants, fine. What are the color of the pants, Rubab? I want blacks, whites, browns, grays. These are all good. I don't want shocking colors. That would be a little obvious and little, I don't want anything which makes you out of the scheme of the exam. So anything which is neutral color, that will be absolutely fine. All right. Invitation with send for the email. Yes, exactly. Ahmed, please print it. It should be with you in case there's some ID problem. Pooja, formal shirt for Hong Kong. Yes, absolutely, Pooja. In Hong Kong, absolutely. Dress shirt, a collar shirt, a formal blouse. And a few of the students, they're very comfortable wearing skirts. If you're comfortable wearing long skirts or skirts with tights, with coat shoes, heels, and blazer, that would be great, Pooja. That would be the best outfit when we come to discussing Hong Kong. Absolutely, black blazer, black pant, white shirt is fine, and it's all good. Yes. All right. Any other question? Cos is there. Yes, I've added. What about white shirt and black pants? That's very nice, love. That looks very nice. For Kolkata also, you can wear that. A few of these students and candidates you'll see in the Indian attire, but always dress shirt and dress pant is always a neutral thing and you can wear that. Beige is very good and very neutral color. Yes, Rohini, you can go ahead with that. Okay. So, but this all has to be decided today because when we are doing revision, I don't want the pressure of the administrative things on you guys. All right. No, open toes are less favorable. Please try to wear closed shoes, right? Avoid open toes shoes because the grip is also not very good of the shoe and it looks less formal, my dear. White top, black pants. No. White top, black pants is better, Shrinka. But if you want kurta, that's also something which students would wear. Depends upon what you're comfortable. Whatever you're comfortable with, you're carrying with grace. That would enhance your confidence and carrying yourself from one cubicle to the other would do the job, right? Um, I won't say compulsory, but this is like what majority wears. So it gives you like, that yes, you are like others, you know. I won't say that 100% it's compulsory. People would be there, but this is what the maximum students they have. Short kurti, okay. Yes, it's okay, my dear. And wearing with the pants, Jyota? Yeah? Okay. So today the task is that you'll work on your sleep pattern, you'll work on your ID check, and you'll work on your last minute administrative things and your dress, okay? And your dress code that is going to be finalized today. Please do not ignore food. Please make sure that from today, even if you had been missing your meals, you're not missing your breakfast, you're not missing your lunch, you're not missing your dinner. For you, it might look like an very little tiny point, but let me tell you that at times you guys say that, ma'am, I had a mental block. Things were not coming in my mind. Food plays a very, very big role in that, especially sugary foods and those which are good in energy, nuts. They play a role in your speech, in your coherence, in your cognition, and your flow. Along with that, you don't have much of the heart sinking at that point. So please don't miss your meals, don't skip your meals. Whatever we have been gaining, we are going to lose after the exam. Make sure that you are able to have good quantity nutritious 3 meals a day with munching in between of nuts and nutritious food. Take milkshakes, take nuts, take honey, all these things, they enhance you, boost your immunity as well, and they help in your cognitive powers. And last minute speech is in a good flow. All right, okay. Now coming to the content. I don't know, you guys are still doing lots of revision and reading a lot of material, reading lots of GTG, especially those who are appearing immediately after one day. I'm talking to the Hong Kong students. The second set is going to be on 10th and 11th, so we have time. But the first set of students, please, now is the time that you slow down and make your brain relaxed. Lots of thoughts and lots of reading material makes you fumble, right? So just last minute points and calm down. Breathe in, breathe out, relax, slow down. For the ones who are appearing on 5th and onwards, the first 2 days of exam, I want you to now a little slow down. When I say slow down, what do I mean by that? Reduce the stress level and control over the heartbeat. I don't want that you're still in the phase of, rapid revision, because this rapid revision can make you fumble because the shooting thoughts, they do not have the coherence with the speech flow. So then you start fumbling and lots of thoughts are coming up. So my suggestion now to all of you is slow down, relax, conserve your energies. In the heart, you can revise the points, less of getting tired, less of exhaustion, please. Do you guys get that? And the most important thing which we have is the mindset from today. You have cleared MRCT Part 2, so nobody doubts your knowledge. Nobody doubts that you have less of an information to give to the patient. But how you give that, that matters. You are not here to prove the entire GTG to them, please. They are just saying that you have safe practices. I repeat once again, safe practices, nobody would compromise on that. Okay? You're outside the cubicle. Breathe in and relax outside the cubicle. 3 seconds in, 3 seconds out. And start with each of the station with a structure in your mind. You should have your points in your mind and make sure that you put the risk factors on the right side as I've coached you in the mock exam, and you remember those. Do not forget the bases like allergies, like smoking, like the medications changing if at all she's not having safe medications, referring to the MDT. You know all the protocol, but it's just that under the stress of exam, you forget the basis. If you don't forget the basis, let me tell you, all examiners are there to pass you guys. The first thing which we have to work upon is mindset, and then is the strategy. Strategy should be very clear. I will stand outside the cubicle, take a deep breath, put your index finger on the station, start reading, comprehend the points. Any risk factor is there, put it on your sheet immediately, make a structure. I will enter into like this. I'll make this agenda. This would be my information gathering. I don't have to forget BMI or this VT points in the history. Whatever you have the history, then I'm going to address the concerns. I'm going to manage the case. We'll keep on checking understanding and wind up. This whole structure should be in your mind. So when you go, examiner looks at you and is very confident that you are prepared candidate. You have to prove yourself better than your colleagues. You have to prove yourself better than all those in the circuit so that you're very, very clear passing candidate, right? Patient safety. Keep on reminding yourself throughout the station that you're not missing out, because that's one domain where nobody would compromise on missing out those points, right? If at all, if at all you face some sort of an examiners, because I always say OSCE is 80% of preparation, but yes, 20% of luck also matters. You might get one of the station, which is the first one, which is like the most difficult out of 14. This is a bad luck. But you might get this as a 14th one, as the last one. It's a good luck. So we are ready to cope up with the bad luck as well. Still, we are going to pass. And if we are having good luck, even then we'll not be overconfident. Have this faith that whatever comes my way, I will face it. I will manage it. One or two examiners can be little uneasy. Every time students, they do say that, ma'am, this station examiner was not very comfortable. I couldn't get good expressions. I couldn't get very a good acknowledgement. So it's all right. Their silence or their mask expressions does not mean that you're not doing good. There will be few that might say, well done. But there will be few that will be absolutely silent, sitting like this and not giving expressions. So nobody is judging you there. It's their way. You have to be on your straight line. Do not change or do not get anxious seeing the expressions of the examiner, right? Your decision making should be patient safe. If at all it is a negotiating station, do not argue. Give the advantages, disadvantages, and just make sure that you are supportive doctor. And at times, 2 to 3 stations, Hansween would be like where you would be ending up the station early. Do not worry, please. Be ready for that. It would happen. It would happen that structured discussions at 8 minutes, you're like, it's all right. Sit confidently, a slight smile, confident smile on your face. And when the bell rings, you just have to say, thank you very much for your time. All right. And if you feel that the time is there and you have not ended up, do the recap of patient safety points. My way was that if it's 9th minute and my data is over, it's all right. All right, I would say just to do a quick recap. So these points are very important in managing this patient. I would ensure that be a patient safe doctor to this. I'm talking about the structured discussions. If you do a recap, you're giving a very clear signal to the examiner. I am a passing candidate, because I always say when you enter, they make the impression. When you're leaving, on your exit, they're going to mark you. So that impression, we are not going to make it a shaky one. Your exit should be very confident. And whatever is that exit, please make sure that your next examiner is not getting that clue. When I'm sitting as an examiner seat, and even in the mock exams, when you guys come to present, I realized that the previous station was not good. Why? Because you start with fumbling. Today, you have to tell yourself that whatever has happened on this station, leave it there. Because the next examiner is totally new. He does not know. Because of one difficult station or one, maybe the thoughts are that you're not doing good, you might affect the next one. Now the exam gets affected. Exam doesn't get affected because of one station. Exam gets affected with consistently you are doing wrong in the upcoming stations. Make a comeback, guys. I used to appreciate myself between moving to the cubicles. Well done. You're okay. You're doing fine. And one more thing, please. If you come on the other side of the chair in the examiner part, let me tell you guys that if it's a difficult station and you are feeling, I don't know it, you never know that you are better than 13 other in the circuit, because they are also making mistake. You have to understand this thing. If you're better than others, the examiner would pass you, but you, because of your underconfidence, you start getting affected for the next station. And that is wrong. This thing you have to tell you today, please write it down for yourself. Leave the baggage of this station. When you say thank you for your time, that station is over. When you go to the next one, start it with again a deep breath and manage that beautifully the way it's the first station. You have to take one statement of mine as a take-home message. Every single station can make you closer to your passing result. Fight for each station and do not lose hope, even if you didn't do as per your expectations, you didn't do in the previous station well, you can still clear the exam. Why? Because everybody is making some mistakes in some stations. So your mindset should be, I'm okay. I am passing this exam. I am still there. I will fight till my 14th station to make sure that it adds on to the percentage. And every single station would make you progress. Are you guys understanding? When I say fight till the end, I mean it. Because this boost will give you push going closer to the success. All right. Hansmi, there's no fixed criteria. Every center has got different results, but it's percentile. And again, if there's one difficult station, it's very difficult for the examiner to fail 14 out of 14. Whosoever would be slightly better in that difficult station would ace. So I just want you to be better in the circuit than your colleagues. So unfortunately, there's no timer and we have to time ourselves, and you realize with your practice that, this much time is over, this much history is over. This is the practice which we had been doing already, but there's no timer there. And there's nothing which you can see because you're moving from cubicles to cubicles. Okay. Now, whatever you have studied, that's part of your knowledge. How you utter, how you speak, how you counsel, and how you present yourself. You just have to work on that. And for that, we don't need the last minute, cramming up the things again. I do not want anybody opens the GTG now or the TOG articles now. Tiny things. I can write it down for you guys. Number 1, make eye contact. When you enter, confident start. In between, address concerns. Information in chunks. Empathy, sensitive talk. Very slight, confident smile and nodding throughout. Stay professional. Exit with thanks and confident, upright shoulders. This is what is needed in MRCOT Part 3. If you are carrying this attire, you're already clear, you're already passing this exam. Right? The content might be too much, but it might not be needed. The whole GTG, nobody has to speak. So when you're saying, I'm still not able to complete my revision, it's all right. Very superficial talk would be there. In 10 minutes, you can't go to the depth. But these points, no matter you know everything, but these points are not maintained. You are not maintaining eye contact. You're not confident. You are fumbling. You're shaky. So that content and that revision would not do the job. Are you guys understanding? So last days, you have to tell yourself confidence, attire, eye contact, nodding, empathy, checking understanding, being patient safe. That's it. That's it. If you do this, everything will be fine. Absolutely, my dear Nisha. Most of 90% of the role players, they are always acting in appropriate manner. But I do have concerns with the last days, or some tiredness comes over in the last day of exam and in the last circuit especially. Students often say that, ma'am, she was not weeping. It was an IUFT breaking bad news. And she was like sitting quietly. I said, it's okay. Even then you have to offer tissue paper, wipes, and water. Why? Because it's part of the scorecard. It's not that you get the complete acting or the response from their side. You should know it's a breaking bad news. It should be a breaking bad news because you are touching the scorecard. At times, they're humans and they get tired as well. But this generally, this review and this feedback comes from the last day of exam in different centers, but it's all right. In UK, you will get very, very professional role players, very good acting, but in other parts, it might be not very good, but it's okay. Adapt to yourself the way they are. But if it's a breaking bad news, do the breaking bad news, my dear. Am I clear? Yes? Any other fear which you guys are having, or any other thing which is in the mind which you want me to address? Anything which is still disturbing you, which you guys think that might affect my performance? Now the preparation time is almost done. Now is the performance time. And we have to perform like very confident professional doctors, safe doctors. Take it as like one day in the clinic and we do the job. Maninder, Nisha, we have worked so hard in 6 months. Whatever it would be, we will face it confidently. I've been with you guys hands in hands in this journey. Time management. If from today, Sadia, because you have time for Jadda, put timers 3.5 minutes and then 4 minutes. 3.5 minutes, practice daily 3 to 4 histories. Okay, Sadia? 3 to 4 histories. You will see that the fifth one would fall in that. Don't put 10 minutes timer. Put 3.5 minutes timer, take 7 stations and do its history only. You will be perfect tomorrow. Just I need one day to do the time management of history. Okay? Do not put 10 minutes timer, guys. We're still feeling that we are having difficulty in the time management for the history. Put 3.5 minutes timer and complete your history. You will see that you will be so good in the last 1 and 2 days, right? So, see me. My way was, I don't know you guys, tea and coffee causes palpitation to you guys or not. Take a breakfast, which you generally do, which makes you comfortable. It can be toast, it can be eggs, it can be anything which makes you comfortable. It can be fruits. Keep one chocolate or something which you, any chews which gives instant energy. All right? Stay hydrated. Why? Because the waiting time where the first circuit is getting out and the second one is going in, or the waiting time where you have 2 hours of ID check and you're not going in, that is a very difficult time. If you stay composed in that difficult time, you would be okay. So have 2 or 3 chocolates with you so that you can eat instantly. So then the circuit, you have your energy. So I used to take it like maybe 15 minutes before entering, right? And that would really give you the morning breakfast or the afternoon lunch if you're in the second part, and then keep 2 or 3 chocolates and water with you. But make sure that you attend toilet, you empty your bowels and the bladder before starting, because I don't want any disturbing thought, because anxiety, stress is there, adrenaline rush is there. Okay. Um, Rohini, in exam, in the center, there's a table where water is there. But when you're moving 2 minutes, 10 minutes, 2 minutes, 10 minutes, and in 2 minutes reading time, you ask for water, definitely you're using the seconds out of your 2 minutes. Okay. So if it's cough, or if it's something like where you think that you desperately need water, you can do that. So you can take it, but you should know that it is 2 minutes, your 2 minutes would be utilized, because no extra time they would give for the water. One more thing. I do that before sessions as well, because at times, because you guys are speaking, hoarseness is there, the smooth voice is not coming up. If you guys are into strepsils, you can put that with you as well. So generally you can take it before entering. I used to do that for myself. I often do that before sessions as well, because at times when you're speaking more, the hoarseness comes, and that, irritation in the throat comes. So that's not lack of confidence, but it happens because some sort of itch and irritation is there. So if that's the case, keep capsules in your bag, and you can just take the strepsils before you start your first circuit. Okay. Even you can keep in the pockets as well. Nobody would stop you with that. That is not something which is, you can tell them that this is, I'm having a throat irritation. So that's the reason, but that really helps. Honey strepsils, lemon strepsils, that really help with your, because the confident speech and, the throat itch and irritation should not be there. Okay. Can we take small water bottles with ourselves between the stations? Taking is not a problem, but you have lots of things in your hand. How would you hold it, Akansha? You've got a writing pad, you've got a pen, so there's no place to hold. So generally they give water, and that is in the center of the circuit. So in between, if you're drinking water, somehow it gives a little, I would say, confusion look. Yeah. But if you want water, you can definitely ask. The coordinator of the exam is there. You can say that, may I have water, please? Right? They would be giving you water. Jeddah evening circuit. I understand, my dear. And that would be the last day. It's absolutely okay, Jannat. I'm meeting you in the Jeddah mock. We'll give you the final tips there. But I'm expecting Jeddah to be a very, very strongly passing center because it's the first one, but hoping for the best and wishing the best. Writing pad is given. When in the morning you go, and you stand in front of the circuit, they're going to say, please stand in front of the cubicle, turn around. You're going to be in front of the cubicle 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And they will give you one writing pad and one pen. So that would be with you from your cubicle number 1. And Dipti from cubicle number 14, you're going to just put it down, on the 14th one, and it will be taken by them. You can't take the writing pad back. All right, okay. So Hong Kong and Singapore are always very good centers, always good centers. But it doesn't mean that all good centers have 100% results. We do have, unfortunately, failures as well. Okay, so what I want is that you be the best of the candidate, right? That is always that you have to know. It's a very professional and a supportive center, but hoping for the best that you guys pass through the confident attire, okay? For Kolkata, November 6th, ma'am. Kolkata had difficult results earlier, but for the last 2 exams, very reassuring. So now is not the time that we think about the center. Now is the time that we think about performance. If one person has to pass in Kolkata, that should be you. If there are everyone making mistakes, if one has to be selected, that should be you, right? Abu Dhabi is always favorite. And similarly, I'm going to see you in the mock exams, all of you. I would give special tips for Abu Dhabi because that's been the place where many of my students, they have been professional role players, examiners known to me. I will tell you, especially for Abu Dhabi, on 8th, on the mock exam, see me with lots and lots of final tips. And for Jeddah and Abu Dhabi, I'm going to give all those details to you guys, specifically the last minute things. What are your expectations specifically for that UAE? Okay, right? See you soon, my dear Dipti. Neeraj, ma'am, is it possible that one center in one circuit all can pass? Absolutely. If everybody is good, why not? Absolutely, my dear Neeraj. Why not? If everybody meets the criteria, examiner would love to. They're not there to fail you. Yes? Okay, there was one question in between regarding the hairstyle. Hairstyle, the ones who are not wearing the headscarf, if you have long hair, make sure that you make a ponytail and then you make a bun which is not having anything on your forehead. I don't want any flakes or anything in your eyes, and make a proper hairstyle. If they're long hair, make a bun, and if they're short hair, it's okay to make a ponytail, but should not be coming in front of your shoulders. All right, it should be on the back of your head. It shouldn't be coming up, right? Okay. And the ones who wear headscarf, the scarf should not be hanging on your shoulders, on your arms. Please wear neatly tied, pinned up if you've got a magnetic one or if you've got a pinned one. I love the magnetic ones because they're so easy and they don't cause irritation on your chin. And then place it under the blazer so that it's a very professional look for your headscarf. And if you can match the headscarf color with your blazer or with your inner shirt, that would really be very professional. Okay, but if you don't have, any light color would do the job, not a problem. All right. And the ones who are making bun, it should not hurt your head, please. Pins and you can take tiny jaw clips and you can place it there, but make it very professional. From the front, make a sleek one. You can use the hair wax to use your baby hair tied and make it a very professional look. For the makeup for ladies, very, very mild, neutral color lip shade would be okay. Light pink or something which is just going with the skin. Nothing darker should be there. If you want a slight mascara, you can put on your eyes, but avoid eyeshadows or very neutral shade blusher, but no heavy makeup, please. I want that you guys are very natural, like, a professional look is there. Also, avoid so much of a jewelry. avoid the too many rings and heavy hands, be confident and look like a professional attire. Hansfin, yes, people they do put, but very thin, okay? You can put very thin, my dear. Don't make it a thick one and don't make it outside the outline of the eyes, okay? Just a thin one, which gives you a confident look, right? Can we keep hair open with clips or clutch? Nisha, will be in Abu Dhabi mock. Nisha will be in Abu Dhabi mock. Sorry, Nisha, you're coming to the Abu Dhabi, you're saying, right? Can we keep hair open with clips and clutch? Depend upon the length of the hair, Nisha. How much is the length of the hair? Length of the hair, if they're shoulder, if they're long, I want you to make a ponytail or a bun, right? And why I want you to make it on the mock exam as well. Why? So you beat through that, you pass through that. And in Jeddah and Abu Dhabi, if you can wear your dress of exam with the same shoes, that would be great. Because I would see also, you can also experience that your feet are comfortable. How do you feel in that? Is it heavy on the shoulders? Is it heavy on yourself and you're being uncomfortable? Okay. So my suggestion would be you can wear the same clothing which you're wearing for your exam. That would be perfect. In fact, wear the same thing, same hairdo, which you are comfortable so that I can also assess and we can discuss about that on that day. What time in the morning? Jannat, I'm expecting 7 a.m. because next day I have Abu Dhabi mock. So I have to leave, in the evening. So 7 a.m. we will be starting the Jeddah mock. Right? I've written in the group as well. If no Moike, writing will be fine, 14 pages, so we can pen down separately for each case. So it's okay to glance on it in between. No, absolutely. If you are comfortable with just making yourself comfortable with simply no makeup and you feel that you're comfortable that way, it's absolutely okay. Your confidence matters, your look matters, very well moisturized skin and, healthy looking and fresh looking face. That's what's needed, Milan. Second thing is that for each one station, guys, for each one station, one simple sheet would be taken. So this is the first one. You're going to change for the second station. You're going to change for, please do not write all the stations or 2 stations on one because that makes you confused. On every station, change the page, go to the next. Change the page, go to the next. Change the page, go to the next. Got it, everybody? Understood? Writing pad has enough pages, more than 14. So for every case, please change the page, right? Entrance ticket printing on 3 pages. We carry all soft copies alone will do. Hansvi, do back print as well. So it will make 2 pages, right? So the first page on the back, the second one, and then the third one. So it will make okay. Yeah. All right. Any other thing which is disturbing you guys? Safa, would you like to say something? Lots of prayers from the moderators and all the coordinators, moderators, they're praying for you guys. Just had a chat with Irim, Soumya. They're all praying for you guys. And we just would be wishing you till the end. And every single day of exam, I would be on my prayers mat and would be praying for you guys. I know how important it is. You guys are part of me. Soumya, as I mentioned, closed shoes are preferred, but not casual ones like sneakers or joggers. So you can have court shoes if without or with heels, whatever is comfortable, but don't wear high heels, maybe 1 inch, right? Is it okay to glance the notepad occasion? Absolutely, absolutely. You can make it a very professional. All right. So as per the BMI, and you can always do that, Milan, right? Yeah. Thank you very
Hello,
much.
ma'am.
Always there. Yes, yes, please, Safa. What are the last moment tips and prayers for them, please?
Yes, ma'am. Hello, my dear friends. I hope that you have very well prepared. So don't worry. Just only one thing. Don't keep anything in your mind. Be open-minded in all the stations. Though just looking at the station, only the candidate instructions, without reading what are the domains tested or what is your task, it won't help you. So read the candidate instructions completely for 2 minutes. Okay, and be open-minded because though it's a recall stations, there may be some hidden agenda. Don't forget to ask about the BMI. And if it is BMI is already given, don't repeat any instructions already given. And be open-minded. Listen to the role player. Don't cut the role player and go with the flow of the role player. You all have prepared very well, and I have seen that in India mock, in both Chennai and Delhi mock, students performed very well, ma'am. So they have all the potentials to pass this exam with a high scores, and we all are praying for you. Surely you all will win. All the very best.
Thank you very much, Safa. And I'm sure that they all would do great. But we are praying for you guys. The points which I've mentioned today, please don't miss them. 30 seconds of silence all together. Let's pray for each other. These prayers of togetherness, may every single day from this point onwards, may every single moment from this point onwards take you towards success. We are very, very sinful, tiny, humble creatures. What we need is blessings now. What we need is the best of the luck to be with us. What we need is potential with confidence that we would do and face everything confidently. 30 seconds of silence, and then we are going to receive. Ameen, summa ameen. May every single minute from this point onwards take you towards victory. May every single sacrifice that you had been doing with your family members, for your kids, for your spouse, for your parents in laws, may that bring up peace and happiness in the coming time. May every single examiner acknowledge that you are a prepared candidate, and above all, may the mistakes which we make under being anxious and in anxiety get masked, and our positive points are so highlighted that we get covered up for those mistakes. May all the blessings be with you guys. I love you guys. I am there. We are going to pray. Would see you guys in different exam dates, groups. If anything is still disturbing, just pick up the phone and call me direct. We are here to support. Lots and lots of prayers for you guys. Don't forget the last minute tips, and make sure that every single moment, keep on reminding yourself, I am ready, I am capable, and I am safe. I am ready, I am capable, and I am safe. Keep on speaking this to you. Everything's going to be okay. Thank you very much. I'm emotionally touched and connected to you guys. Each one of you is my responsibility. The only thing is that be yourself, be confident, and the efforts you had been making, just prove that it would lead to you success. Thank you very much. Love you guys. Take very good care of yourself, and best of luck once again from the entire team of RFA Tutors. Thank you so much. Bye bye. Would wait for you guys in the successful champions meet. Thank you very much. Bye bye, everybody. Take good care. Thank you so much. Bye bye.